Hello everyone. So I will start this blog by talking about the leadership questionnaire we all took. The leadership questionnaire measures three broad categories of leadership skills. Those are administrative, interpersonal, and conceptual skills. I scored in the very high range in the administrative and interpersonal skills and high range for the conceptual. In order to obtain necessary resources such as staff, I will be using administrative skills. Chapter 7 of our book is describing traditional management functions as planning, organizing, staffing, directing, coordinating, and controlling. Nurse managers' responsibilities include accomplishing the goals of the organization, maintaining quality of care for the patients, managing the department budget, maintaining a positive work culture by developing a team, boosting morale of the staff, and overseeing the onboarding of the new hires as well as retention of staff, and furthering the professional development of the employees. To secure needed resources such as staff, a manager needs to have a good understanding of the staffing plans and the budget guidelines. And also, the manager must know the workflow and the unique needs of her individual department. The manager also must be aware of the skill mix of the staff, therefore, no shift should be scheduled without adequate skill mix balance. For example, you don't want to schedule a shift made of just all new graduates, people who are just out of orientation, couple of months, with no one to mentor them or answer their questions or guide them in case of a patient critical situation or crashing or a code. While planning the staffing, the manager must also take into consideration of the scheduling flexibility needs of her staff, because we all know that in nursing, the staffing as well as the scheduling are the key components of nurse satisfaction, which also means nurse retention, and we must do anything and everything possible to retain our nurses as managers. The peer-reviewed journal article I picked is titled, it's a long title, Implementation of an Interdisciplinary Team-Based Complex Care Support Healthcare Model at an Academic Medical Center, Impact on Healthcare Utilization and Quality of Life. It was published February 12 of 2016 in a journal called PLOS ONE in Canada, but the study was actually done by the University of California, San Francisco Department of Medicine. And the study is about, first of all, I need to describe a little bit complex care patients. Complex care refers to patients with healthcare needs that are complicated by significant medical and psychosocial factors. And I found this very interesting. I'll share this with you. Patients with complex care needs are a major driver of healthcare costs. And these patients are only 10% of the patient population, but they account for 64% of total healthcare costs. What the researchers in this program did, that they developed a team-based, interdisciplinary team-based healthcare delivery model, and the team included a nurse practitioner, a nurse, social worker, as well as a pharmacist, a mental health specialist, a geriatrician, and physical therapists and other therapists as needed. At the end of this randomized control trial, patients who were taken care of and in this interdisciplinary team, they had decreased healthcare utilization, decreased healthcare cost, improved quality of care, increased patient and provider satisfaction, and improved quality of life. So that says a lot for the value of interdisciplinary care models in our institutions. In my department, nursing care delivery model is best described as partners in practice, as explained in page 162 of our text. which is a professional nurse teaming with a nurse aide, and they partner to take care of a set group of patients. In my department, the ratios are 5 to 6 for a med-surg nurse and up to 12 patients for a nurse aide. And we try to assign our nursing assistants to only 2 nurses so they can participate in some sort of partners in practice model of nursing care delivery. If I were to be promoted to be a med-surg unit manager, I would like to use the literature to seek out evidence-based best practices out there to evaluate if there was a better care delivery model that we could adopt. As a nurse manager, I will need to work well with pretty much with all the other interdisciplinary teams in the hospital, on the clinical side as well as on the administrative and support side. These will include providers, lab, RT, PT, OT, bed flow, patient placement, dietary, environmental services, engineering, nursing education services, equipment and supplies coordinators, human resources, and performance improvement specialists. I got the organizational charts of my hospital that I work at. Interestingly, we had 2 separate organizational charts published. One was for the organizational chart for nursing department only, and the other one was for the whole entity. And the organizational chart for nursing only was a vertical structure, and the organizational chart for the hospital under the leadership of our president was in a horizontal structure. I'm happy with my entity's vertical nursing structure because the lines of authority is clear, and our policies and our care guidelines and how we conduct ourselves are all written and same throughout the hospital.